Hey everybody, Dr. Ross here. And today I'd like to take a couple minutes at most just to talk about something that I see quite often in the gym, and I see quite a few patients in my office for foot problems or foot pain. And they've been told it's plantar fasciitis. And the two most common things that I hear that patients are being told to take care of this is stretching and using some sort of orthotic or shoe insert. The problem is those two things don't seem to work very well. I see patients who have struggled with this for a long time, and it's not getting any better, no matter how much they stretch or wear a sock at night that stretches out the bottom of their foot. The challenge is that I think it's misdirected in that stretching out the tissues will not relieve the problem, and putting some sort of insert under there also will not relieve the problem. I think a better approach based upon the structure of the foot, just to remind you, the structure of the foot is made up of two groups of tissues. One, the muscles that go across the bottom of the foot, the intrinsic muscles, and the fascia, connective tissue across the bottom of the foot also. Quite often, people will have pain back where this fascia and these tissues attach at the heel, and it can progress through the entire foot. And it's from an irritation of those connective tissues, the plantar fascia. The foot is designed to be an active, spring-loaded mechanism for walking, running, lunging, moving, doing all these things. So the muscles need to be strong enough to support that arch of the foot. If the muscles are not strong enough, then all of that force from lunging and running and hopping and walking gets transferred onto the underlying connective tissue or fascia, and that irritates the fascia. The best fix is to stop the irritation of the fascia by improving the strength of the muscles. The more that the muscles can handle as far as force with running, jumping, lunging, doing all those things, we build up the muscle, then we'll take the stress off of that plantar fascia, which will help to reduce that irritation, inflammation, aggravation that gets labeled as plantar fasciitis. So the secret being to strengthen the muscles of the feet. We forget that there are intrinsic muscles. There's a whole lot of small little muscles that go longitudinally, transverse, diagonally through the bottom of the foot. The other thing that I see is that insole or that insert creates this big hump or unnatural arch. And so it supports that arch passively so that your feet don't have to work at supporting that arch. Anything that you support will become weaker. So I think in short term, while that arch support may feel a little bit better, what it's doing is undermining your training of those muscles that need to be worked in order to get stronger and support that arch from a natural and intrinsic manner rather than an artificial and extrinsic and supportive manner. As you may or may not know, on here I have, and on my YouTube channel at Dr. Try on YouTube and at Fulcrum Lever Sport on Instagram, exercises that specifically target the muscles on the bottom of the foot. Take a look at those and let me know what you think.